Surgical Options, A Treatment Guide to Parkinson's Disease by the Parkinson's Foundation. Narrated by Marisha Tapera and Justin Sewall.
The aim of this audiobook is to describe the various types of surgical treatment that can be utilized to reduce Parkinson's disease, or PD, symptoms in a subset of carefully selected individuals with a specific symptom or symptoms. This audiobook will focus on the following potential therapies: deep brain stimulation, duopa therapy, lesion therapy, and focused ultrasound. This audiobook was designed as a practical guide to explain the complete process required for people with Parkinson's and families considering surgical therapy. The content describes everything from the decision to have surgery and the day of surgery to surgical recovery. While the information contained in this audiobook is intended to facilitate a discussion of surgical options with family, friends, and healthcare team members, it is not meant to replace the advice of expert healthcare professionals involved in your care. Parkinson's Foundation Resources. A comprehensive Parkinson's disease glossary can be found at parkinson.org/glossary. You can find more helpful tips for managing Parkinson's-related speech and swallowing changes in the books, fact sheets, videos, webinars, and podcasts in our PD library at parkinson.org/library.
Chapter 1. About Parkinson's disease. If you're listening to this audiobook, you are probably already familiar with Parkinson's disease, but here are some basics. Parkinson's is a progressive neurodegenerative disorder that affects about 1 million people in the United States and 10 million people worldwide. It is called a movement disorder because of the tremors, slow movements, stiffness, gait abnormality, and muscle cramping. These symptoms are often referred to collectively as the motor symptoms. It can also include non-motor symptoms such as depression, anxiety, apathy, fatigue, and sexual dysfunction. During the initial stages of PD, that is, the first several years after a diagnosis, medications typically control symptoms in the majority of people with Parkinson's. As the disease progresses, however, individuals may need to take more medications, increase the dosages, and, in many cases, take their medications more frequently. As disease duration increases, people with PD may notice that throughout a typical day they will experience good symptom control, referred to as on time. There are also commonly periods where symptoms are much more noticeable, referred to as off time, and periods where peak medication levels, usually an hour after taking a medication dose, produce involuntary movements. These involuntary movements are referred to as dyskinesia. When individuals change from one of these three states to another, they are said to have motor fluctuations. If you are considering surgical treatment, first, consult with a movement disorder specialist. A movement disorder specialist is a neurologist who has completed specialized training in PD and movement disorders, usually through a 1 or 2 year fellowship. Make sure you ask for credentials. There are also neurologists in practice who have become experts in this area through their experience caring for many people with Parkinson's, and also by completing continuing medical education courses. Then, do your homework. Learn all you can about the surgery you are considering. Call the centers that you may select to perform the surgery, and ask questions about the care they provide. Make sure that you choose a center with an interdisciplinary team of healthcare professionals. These professionals should have the training, technology, and expertise required to provide specialized and expert therapy. Make sure the interdisciplinary team has a team meeting where your case will be discussed by everyone who evaluated you prior to any surgery. This type of collaboration is considered an essential element to the success of this procedure. Next, be prepared to invest a significant amount of time, energy, and travel for both pre- and post-operative appointments, especially
Sample complete. Ready to continue?